So good afternoon. This is Kurt Pringle with a webinar on thinking about tomorrow today. Over the last few weeks, we've been talking to different companies that are providing service really to businesses and others as they think about how their business will move forward, how they will move forward, how public agencies will move forward. So this is an exciting time because we all get to do things new for the very first time. And companies are formed to be able to address those needs. But also companies that have been out there doing a whole bunch of things now are being able to focus on the COVID issue and businesses return through COVID. So that's really what we want to talk about today. This is kind of exciting because one of those businesses that has pivoted and has just started up focused on how businesses and public entities can make sure their workplace and public health is addressed, how those facilities are available for the public to be in, clients, customers, as well as your employees. And all of those issues are really relatively new issues for people to consider now in this COVID era. I was going to say post-COVID era, but we can't say that quite yet. Hopefully we'll be able to say something like that in the near future. So today we have with us Tatum Pollard with USVMA, U.S. Virus Mitigation Agency. Their whole focus is how do they bring different providers together to address issues of employers, government, and building owners to ensure that those buildings are safe places, strategies towards eliminating pathogens and moving forward. We have, I was going to say Brad, it's David Kahn. He was just telling me the true origins of the name of his company, Forensic Analytical Consulting. Sounds kind of scary. Sounds like CSI type stuff. Actually, it is. So when we talk to David, we'll get that covered. But also we have Dr. David Pham. And Dr. David Pham is with Rapid COVID Labs, one of these companies that is very aggressive in doing COVID testing throughout Southern California. So let me just get with it before I really get too deep on this. I want to make sure, I think I've given enough quick overview at the beginning, but let me just go right to you, Tatum, and talk to, what does USVMA do? What would you do when you go out to a manufacturing plant or a warehouse or a retail storefront or a restaurant? What are some of the services that you think are important that people need to be able to see to address some of the needs of today?
Sure. Well, before I share my screen and kind of run through some of those services, I think it's helpful to understand the impetus for the formation of USVMA. I think all of us kind of have been frustrated by the fact that there's a lot of guidelines out there and a lot of different protocols and a lot of different voices and not really any consistency or understanding amongst them. And so that's kind of the impetus for why we formed what we're doing here. I'll share my screen really quick just to kind of walk through. So basically, we kind of break up how we work with clients into three kind of tiers. Our fundamental services, we work with industrial hygienists, like from David's team, who really understand the roles, the controls and risks within an environment. So we can go into different restaurants, offices, venues, events, and do a full comprehensive evaluation of the risks and controls within that environment. Additionally, we can provide disinfecting support. I know that there's a very different level between just janitorial cleaning services and actually disinfecting that's needed to kill a virus of this magnitude. So we come in and provide that. We look like little Ghostbusters coming in and with all the chemicals and equipment needed to kill the virus. And then everything from providing PPE and actually COVID-19 testing, which Dr. David Pham can talk about in just a bit, and make some initial site recommendations and protocols for businesses to reopen or stay open safely. From there, we can develop pathogen resistance programs, and those are really certified to, tailored to the specific client and the specific environment that we're working within. We have an advisory board that consists of various public health experts, medical doctors, certified industrial hygienists, and basically we take these site evaluations and bring those to our board and can offer consulting services for our clients to really make sure that the recommendations that we're putting forth are accurate and to the highest level of quality. And then finally, the third component is the certification process. So much like the grading systems that you see in different restaurants, we really do believe that COVID is changing the world forever. And when people come back, they're going to need some kind of barometer of peace of mind. And so through all of these services, that certification is kind of the final component to say, hey, this business has really done their due diligence.
Yeah, last week we had a couple lawyers from the law firm of Rattan and Tucker here at Orange County-based Pham, and really what they were talking about is how businesses can protect themselves from some of the liability out there. I would assume in terms of walking through some of the services you provide and even getting to the point of being certified that you've addressed these by a third-party evaluation, which you would provide. I mean, that does possibly address some of that or answer some of the questions. What have you done as a business to ensure you have a safe and operable, work environment?
Exactly, Kurt. That's such an important component of why we formed what we're doing, because people are scared to reopen, and they're scared to bring their employees back to their office, and the liability if someone gets sick. And so basically, all the services are so comprehensive to equip employers and businesses with multiple checkpoints to say, hey, we've really done our due diligence, and here's kind of the comprehensive plan that we've done to follow that. And looking to the CDC and WHO and these other powers that be, and modeling after those guidelines so that the employer feels like they're equipped with kind of all of the checks and balances that they need to feel safe.
Yeah, I think I didn't really learn of this new profession that I didn't, sorry about this, David, that I didn't know was out there before, known as industrial hygienist. And it is exactly what it says, but it is so magnified in the level of service. So I know that David Kahn with Forensic Analytical Consulting, which is a mouthful, and it's kind of a cool name. Let me just make sure I properly introduce David. He's been practicing environmental consulting and public health for 9 years, focusing on areas of indoor environmental quality, waterborne pathogens, hazardous building materials, and risk assessment. And in his role, he's worked with the significant projects in healthcare, government, education, and the public sector. And so you'd label yourself as an industrial hygienist in some sense, but you and your company are some of the first ones that come in the door under this process, right? In the evaluation of a workplace and a public building or a school or something like that. Tell us about how that works.
Sure, absolutely. Yeah, so industrial hygiene is something that you don't hear about very much. Our job is, as industrial hygienists, to, the slogan is recognition, evaluation, anticipation, and control of hazards in the workplace. And really what that means is we look at the kind of series of events that happen between having a potential hazard and having an actual adverse health event or negative event of some sort. And then we help you figure out how do you interrupt that chain of events so that your potential hazard never actually becomes a real consequence, right? And in this case, in the case of COVID, that means that we're here to help you develop, it's doing the risk assessment. Okay, how do we evaluate a site, a workplace, whether that's an office building or a manufacturing facility or a school or a hospital, and implement controls that will reduce the risk of going from a potential hazard, in this case let's say someone who is infected with COVID comes into a work site, and then the adverse consequence, which is in this case the transmission of the virus from one person to another, leading to further infection. And so yeah, that's kind of really our role is it's sort of a generalist specialist, if you will. We aren't we're integrating a lot of different sciences and a lot of different information to look for that key step or key element where you can put, interrupt that chain of events that leads to a
So,
infection.
so from that, the outcome would be what? A report that really shows all the areas where improvement could be made, suggestions, and a roadmap of how to address the needs in that particular building or facility.
Exactly. And so in the case of COVID, we're really looking at a few, depending on what the particular needs of the client or the site are going to be, it's development of a report that identifies the points of risk. It would be development of safe work practices to protect employees and site visitors and clients who might come onto your site. It could be a full safety program that we help partner with you to develop. In general, when we're responding to a COVID concern, we really look at it as, kind of how do you protect people, how do you protect resources, and how do you protect your reputation as a business?
Yeah, I want to make sure everybody who's listening in, they know they can push a button down at the bottom there, the Q&A, and ask a question. And if it's a really strong one, then we'll make sure we ask the panel. So do your best thinking on that, and we'd like to have a discussion about what's on your mind as well. So, but on that, David, maybe you could take the next step with me and tell me what should a person who owns a business right now, their number one issue that they should address. Granted, I know industry by industry stuff and all of that, but really, what is the most common thing that you see that is a simple fix to address some of the issues that are out there?
Sure. Gosh, I think, it probably sounds maybe less simple than it can be, but I think the simplest thing is having a plan, having a safe work practice to protect your business, because there's a lot of guidance out there. Tatum's talked about CDC and WHO. There's state guidance. Often there's even county by county guidance. If you're a single business operating within one county, even just keeping up with the changing guidance in your county can be difficult. If you're a business operating across multiple counties, multiple states, multiple jurisdictions, it's incredibly difficult to keep up with all the guidance from all the different agencies. And so just having a plan that incorporates appropriate guidance and sets a standard for your business that, here's what we're going to do. Here's how we're prepared to respond if we have a case. Here's how we're going to prevent transmission at our business. Here's how we're going to handle the logistics, right? That's a huge challenge that I think everyone's been facing right now, or especially it was facing back in March and April, and is how hard it is to get just simple cleaning supplies. You can't go to the store and buy a box of Clorox wipes right now. And so just having a plan, here's how we're going to prevent it. Here's how we're going to respond if there's a case, and here's how we're going to manage this plan. And then I think I always want to speak to the liability issues and concerns. Here's how we're going to document and validate it. We're going to have a log, or we're going to have something that documents what we're doing, so that and you have to think of it as when you have some sort of issue come up, whether that's just concerned employees or that's an actual case, you can say, not only do we have a plan, here's the proof that we've actually been doing this. And there's a lot of good guidance out there. You can start pretty small on this, but
if I could add, David, to what you're saying too, I think it sounds so simple to say, oh, have a plan, but just from the conversations that we've had with some clients too, I think, there's a lot of public businesses out there, they have to have a plan of some kind in order to open and to kind of stay open. But is that plan contextualized to their situation? I think that's something that we've really seen on the ground is, yeah, we have a plan, we had to have one to open, but it's like, when crisis hits, or when it actually comes to you and you're affected, how do you put that plan into action? And is that plan tailored for your business? Is it up to date, to your point, David? So I think we've seen, just in the conversations we've had, being able to call us on the phone and say, okay, we had a plan, but we're kind of paralyzed right now. We don't know what to do. So I think having the resources in place to be able to put that plan into action, we've seen is helpful.
And one of those plans is if someone tests positive or someone has symptoms or someone's family member may have symptoms. I think all of us are really concerned about how do we get tests, how do we get an answer to that question. So part of that whole US VMA service offering is a testing component. And it's really good to have Dr. Pham here. And let me just make sure you know how special this guy is in terms of his background. Dr. Pham is with the Rapid COVID Labs. He was trained at NIH under Dr. Fauci as director. That's impressive in all accounts today. Trained at the National Jewish Health, which is the #1 pulmonary hospital ranked by US News and World Report. And now you run a clinical research facility working with major pharmaceutical companies, and you're telling us earlier that now they have a lot of need for ramping up some of those tests. But you're also providing with your clinics and also mobile clinics and access to businesses and business operations, testing options that people should be aware of and can take advantage of. Tell us a little bit about how that works.
So back in, as you know, when late March occurred, and the president basically shut down all businesses and safe-at-home order, all the drug companies, and especially in respiratory field, because we were blowing and we're coughing in the office, and they were very concerned about infection within the workplace and within their research. So they basically shut everything down. And to reopen back in May, I had to submit a protocol that a lot of these pharmaceutical companies, and they probably have a lot more people with more brain power than I have, that basically scrutinize our protocol that no, you can't open, or yes, you can open. And when I submitted that, we reopened within 2 weeks of that submission. And because of the speed of which they allowed me to reopen, I basically said, why can't I take this protocol and apply it to regular businesses that are not as impacted as I am, or as more impacted, i.e. the bars, etc. And I took that and we started ramping up and reviewing all the different technologies that exist, from antibodies to PCR to different rapid tests. And we ended up selecting a rapid antibody test and also this PCR, and we spoke to CEOs of the company so that we can have a rapid turnaround. And we basically launched officially 2 weeks and 1 day ago. And in the process of that, we now are working with completing a movie studio filming. We have 2 or 3 other movies. I've done multiple restaurants, an engineering firm. We're in the process of talking to 2 banks so that we can help them reopen and attempt to risk mitigate. And of course, one of the things that you mentioned, our governor basically have shifted the issue of getting workers' comp for individuals that get infected in the workplace. And so how do you take all the tools of testing and apply it to an environment that is so volatile that can change rapidly, as we saw in the last 2 weeks?
Right.
The 4th of July opening up and everybody's celebrating. The numbers in the county just shot up. Orange County shot up from 1,000 yesterday to 1,300 today, and LA County is probably doing the same thing. And for those watching in areas like Texas or Florida, Florida hit over 10,000. It's been chaotic. And so how do you use these tests to detect? So if you can you put up this first slide on the virus and how it generates antibodies and so on? I apologize for the blurriness of this slide, but I'll walk you through it. Can you see my mouse or my arrow?
There you go.
Yeah.
So if you came in contact with a person on day 0 here, the virus will then enter your body, and within the first 3 days, the best testing is actually a PCR, okay, where no immune response has started. And so if you were wanting to get tested, infected, let's say you disappeared on Friday and went to a bar Friday night and you came back to work on Monday, and you had a little bit of fever, and your employer saying, hey, you have a fever, you should go get tested. So in that scenario, we should get a PCR test, nasal swab, or an oral swab. Those are the 2 technologies come out. because they're looking specifically for the RNA. You can detect that. Within 5 days, you start seeing the IgM here. This is the IgM. For those that don't really know what IgM is an antibody response that your body generates as it comes into a pathogen or a virus or a bacteria that enters your body. And this is how you fight off that infection in the first few days. Over time, from day 0 to day 7, the IgM starts going up. And within day 7 to day 10, your IgG starts going up. IgG is basically what we refer to as your immunity response or your memory response, meaning that let's say you've gotten a flu vaccine and you get vaccinated, and through the whole season, your IgG level goes up high enough so that anytime the virus comes back into your body, you can now fight that virus. And that's what the IgG response is. And that's what we've heard on the news as, quote, herd immunity. And so with an antibody test, if you were in the 5 days, you'll see IgM. If you were greater, then you'll start seeing IgG coming in. And this is where the antibody response really works really well, is from day 7 on, depending on whether IgM or IgG occurs. And as you can see, the virus starts dropping off unless you get a full-blown infection where you're hospitalized. In a full-blown infection and you're hospitalized, these humoral responses haven't really started yet. You're still on the, quote, cellular response. That's why you hear these news about cytokine storms and all the cells going nuts and causing respiratory failure, heart disease, lung disease, etc., that occurs. And that's because the cells are fighting like crazy. And those patients, no matter what, you still won't really see the humoral IgM or IgG responses that occur.
So let me just make sure, and leave this chart up here for a second. So really what you're pointing out is this IgM, which is that first dark dashed line, and then the IgG. Those are two responses of your body to fight off the bacteria, right? Or the virus, correct? Right. So through the processes of your testing, I think this is confusing to people, and believe me, it's confusing to me too, that you have an antibody test that sees if any of those have been triggered, and if they have, then you can take a secondary test to move towards tighter confirmation of whether someone has COVID or not at that present time, right?
Yes, so that's a very good question. So let's say if you're applying this to a population within the workplace where you have 100 to 1,000 employees, taking out 10 to 20 minutes of their time and waiting a 24-hour period for a turnaround, fastest turnaround for a PCR would basically shut down the whole workplace.
Yeah.
Whereas rapid tests can occur within 10 to 15 minutes. And depending on their history, you can detect their IgM really quickly if they've been exposed within the last week, let's say. And if their IgM is positive, then you isolate those people out and do a PCR on them and send them home. And so you would only take out basically 5% of the workforce instead of taking out the whole workforce and waiting for results. The prevalence of COVID currently, depending on which study you look at, whether it's the UCLA study, which showed 4.6% or 5%, and the Stanford study, which shows about 2 or 3%. So taking out 5% of the workforce versus taking out the whole workforce because you're waiting for a test just doesn't make sense. So antibodies are great for screening for people. And if you detect these people that have been exposed within a 7-day period, and you take them out of the workforce, then you apply a nasal swab. And if you've never had a nasal swab done, I recommend you do it and see if you love it or not. It's not the easiest test, having your nose prodded with a tube. And some people stick it all the way to the back of your throat and twist it around and doing this. It's extremely uncomfortable. And so as a result of that, we decided to do a simple antibody test as a screening tool, just like how, breast exams for breast cancer or colon cancer screening. So these are good screening tools that can be applied on a regular basis to a workplace. We're negotiating with another company now to do it twice a month, and it basically will cost $110 to $150 a month extra to provide these services to the company and mitigate risk within that workplace. Whereas if one person gets a workers' comp claim, they'll blow your budget right out of the water. Now imagine 5% of your workplace getting that.
So let's drop this slide if we can. And then, Doctor, there's questions, and I think there always seem to be this leading question in terms of testing that's approved with the FDA approval. Since all of this has happened quickly, not all of these types of tests are FDA approved, but they have an emergency approval. Is that right?
Yes, so currently none of these tests are, quote, FDA approved. They are under the emergency approval system right now because of the nature that it's very rapidly done. Many of you have seen on, I think it was CBS, the wild, wild west of antibody testing. What happened was that initially from March until late May, a lot of tests were approved based on the company's submission data. Around beginning or mid-May, the FDA submitted all these test kits to the NIH for review. And after that review, only 2 antibody tests survived. And the FDA, as well as the NIH, made a requirement that most of these tests had to be 97% or higher to get approval. And the test that we selected ended up making the cut as the only 2 antibody tests as of late May to get approval under that 97% guidance.
Okay.
Now
So could
approve under EAU, emergency approval, not
authorization.
full approval.
Right. So maybe you could say it one more time, since those of us who are slow get it. So you have different steps on testing, and based upon what you determine in some of those from one test, you then will take the next step to another test to get further and more clarifying information. Is that right?
Correct. So if you were asking me to come into your company with somebody that's already testing positive, I would come in and ask exposure history of everybody and do a massive screening using an antibody test. If any of those antibody tests test positive, we then escalate those people to do a PCR test to confirm. The reason for that confirmation is that, do I isolate you for 2 weeks because you have the virus, or that the virus has already passed? Remember how I showed you the curve that goes like this? Are you on this end of the curve or on this end of the curve, right? With those two together, you can actually enhance detection. And there's been a study that evaluated where you combine those 2 tests, it enhances the positiveness of the testing up to 99%. Whereas most tests, if you've heard on the news, at 97, you can miss a few, but at 99, it's significantly better.
Right. So that test, how does that antibody test performed at your facility?
So what we do is that I ask for your finger. How many have done glucose checking for diabetics? You've seen that. I swab your hand clean with alcohol, get a lancet, which is used for diabetes, poke your skin, and then milk out 2 droplets of blood. Okay? The kit recommends 1, but I use 2 because the more blood, the better detection of the kit would be. And with that, we put it into the well, and then we add 2 drops of the developer. Wait 10 minutes. Within 10 to 12 minutes, you'll get results. There will be 2 lines. How many have done urine pregnancy test? Right? You pick up, and then
None of these guys.
you get a stripe, right?
Right.
And this is the case where the antibody will show a stripe. So if you have IgM, which is the first line on the kit, it will light up if you've been exposed within that range, as you've seen by the curve. Then the next line up is IgG. If that lights up, you'll see it. And then the third line is basically control that says this kit is working. If the control doesn't light up, that means the kit is bad and you have to do it again.
So the reason you use that as kind of the introductory test is, one, it's cheaper, easier to perform because it's just a finger prick, and you can get rapid response in a day, correct?
Within 15 minutes. And
right.
so,
and then if you have someone who shows that they do have the antibody, you can then do a more complete COVID test after.
Well, and then so the PCR would follow with that. Tatum has seen us in action where she booked 2 restaurants with close to 250 people, and we managed to do the 250 in 2 hours. And so basically, if you're back in operation and you needed your workforce to be at 9, you bring them in at 8. We send our team to your workplace. We can do 100 to 200 people in an hour or 2, and you can go back and work and not have to worry too much.
Yeah.
Right. And I think, there has been some, be it criticism or otherwise, of the antibody test. But the antibody test, you're not saying this is a definitive test if you have COVID. This is an early warning signal. You'll get that information. And then if you do need to do the PCR secondary test to confirm the COVID, you only take those people who are needing to do that, because the PCR takes longer to get results, doesn't it?
Yes, PCR turnaround, the fastest I've done is yesterday I went and did a house call on a movie director in Hollywood, dropped off the kid at 4:30 last night, and we have the results at 3 o'clock already. I mean, that's because I pulled a favor, but not too many people can get favors like that. On average, if you do it.
So someone, average guy like me, what is the time on that?
For you, with me, less than 24 hours.
No.
On average, through labs, if you're attending public health, it's up to 7 days.
Right.
If you have a good lab that's running 24/7, it's 72 hours.
And Dr. Pham, I think with some of the folks that we've been sending over to your lab, we've for the PCR tests, we've seen results in 48 to 72 hours with those ones. And I know just the rapidness of the actual rapid test and the PCR test has been something that we've seen is just companies are desperate for right now, because to Dr. Pham's point, they need to reopen and they need to know quickly who they can send back to work and who needs to quarantine.
Right. And I think that is such an important step. So one, making sure you have a safe work environment, a safe place where your customers feel comfortable, and having them see some type of certification review, so they know that that business has taken steps to really establish a good, safe environment. And then what do you do with employees? So I do think that was a good explanation, Dr. Pham. Probably too long, but it really helped me, and I know it helps other people, because you were telling me there are those 3 steps of testing that get more and more precise, but they also take longer and longer as you take those steps, and they're probably more expensive as you walk up that path. So why have everybody take the PCR test if they don't show symptoms and things like that? So that's why you do that initial antibody test screening, right?
Right. So one of the questions that was just popping up was that, is there a rapid antigen test? And the answer is yes, but that's not specific enough. It's for the N protein of COVID, and that N protein is found in other coronaviruses too, such as SARS-1, which occurred back about 8-10 years ago. And coronavirus, for those that don't know, is actually a common cold virus that you've gotten through the years. Any of us can say that we've had a cold at least once or twice a year in the last decade. Okay, and so the rapid test is not very specific enough. The PCR is specific for the spike protein, which is specific for COVID-19. So that's the reason why we decided to do it antibody first as a screening tool, then step up when you see a positive test.
That's great. So David Kahn, tell me, what are some of the innovations? I mean, it seems like in a lot of realms, people are looking to do things differently and finding new ways to deploy technologies that are out there. So in terms of kind of addressing this in the workplace, I mean, I've just been introduced to somebody who has lighting. It's a certain type of UV lighting and a certain spectrum that kills the virus after so many minutes within that light. I mean, maybe you could share with us some of those, some of those new innovations out there and technologies that are being used.
Sure. And I will say, I think it's there's a lot of research being done on a lot of different topics here. A lot of this information is pretty preliminary, and so we don't know that, you know, specific it's something where you want to be careful about evaluating any new technology or process or cleaning product, and whether or not its application and the data supporting it are appropriate for your particular use case. UV germicidal irradiation, as it's called, or UVGI, is something that people have been talking about a lot. It's right at the beginning of this, people, you know, one of the big things that was coming up was a shortage of PPE, and there have been a number of studies using UV light to treat or disinfect respirators and other PPE that looks very promising and effective. And, you know, being able to take previously disposable respirators and reuse them at least for a few times, you know, essentially turning one respirator into 3 respirators or something like that. The other, I think, most promising avenue of research in UV irradiation right now is in air treatment, using, there's a few different kind of technologies that are in use. There's companies that manufacture UV irradiation systems that are installed in line with your air handlers. So as your building air is cycled through the air handler, it also gets a UV treatment that should remove or deactivate viral particles that might be carried in that airstream. It's a very promising area of research. I don't know that we have necessarily validated studies on its effectiveness for COVID yet. And then the other thing that you might hear about is upper room irradiation. It's a technique where you use UV light at kind of engineered designs of UV lights to have a high enough intensity of UV light in kind of the upper levels of a room that it'll kill off viral particles that float up to that level. And so you combine that with fans or another system that circulates air in the room to reduce potential viral loading in the air of that room while not actually exposing people to UV light. Because that's the big challenge with UV light, right? We all know it. We've all run into it. We've all had that's what causes sunburns. There is a real hazard where if you expose a person to too much UV light, you give them a sunburn, and with all the potential risks that follow on from that. And so you have to be careful about where you apply it. You know, similarly, there's techniques for application of disinfectant, things like electrostatic spraying and stuff, which when we started this, there weren't really, I think there was one electric product approved for electrostatic application, and the EPA has now announced a fast track process for approving that. So you can expect to see probably a whole bunch of products come out soon that are approved for use against COVID by electrostatic application, which is, it's a method that applies a disinfectant to a work area that
no, Dave, let me make sure you know what I'm talking about.
Yeah.
I want to go to Anaheim Ducks games.
Right.
So I want to be able to figure out what can those guys do in the tunnels as I'm going to my seat, be it lights or something else, that everybody
Fair.
that goes in is safe and all of us can enjoy hockey again. So sorry, that's my
Gotcha.
family's sports preference.
Priorities.
Trying to figure out how to get back
Yeah.
into with everybody feeling good. So.
Unfortunately,
No, don't go there, man. I mean, if you're
so the bad news, and I'm just going to start to get this out of the way. The bad news is that if you have someone who is infected, the challenge is that they are continually releasing new viral particles. And so if if we could figure out how to disinfect that person's insides, we'd have a cure for the disease, you know? And so as long as we're dealing with bringing people in, unless we can reliably screen out anyone who is carrying the disease, even if you have the best disinfection technology in the world, I can wash my hands perfectly. I can disinfect my clothing. The first time I talk or shout, and if you're going to hockey games, you better be ready to shout, you might be spreading more viral particles around. If you're
so the question then, if I can jump to the doctor, is what about taking a temperature? At what point in time does temperature go up with someone who's infected? Because you know, we're all having thermometers in our offices. I got 2 in mine if you want to come by and check it out. But they also have these thermal imaging systems that some companies are talking about, that as you walk up to the Honda Center to see your Ducks game, it can look and take multiple temperature readings of all the patrons coming in. I mean, how complete would that be? Would you?
I just came back 2 weeks ago visiting the Venetian Hotel in Vegas and the Wynn, and every door entrance to the casino has a scanner. And imagine if the outside is 100 degrees, you're walking in a little sweat. I mean, they have a secondary temperature because they don't want to interrupt the flow in the hotel. So if you light up red, then they pull you over and they scan your head with a thermometer. Those are good detections tool versus nothing. So let's say your risk is 100%, having a temperature, you reduce it by maybe 50%, random number I'm making. So those, the clinical questions, the clinical history, the exposure history will reduce your risk, but it won't completely reduce it. So that's why the CDC has recommended temperature checks, these questions, masks, face shields, social distancing, and hygiene. And then testing adds another reduction in it. The hotel at the Wynn, every blackjack dealer, every dealer walks into the hotel through a UV light. They have 5-foot towers on both sides that scan front and back. So as you walk through, your clothes is, quote, sterilized. And every time they leave, they're sterilized, okay? The Venetian does testing every 2 weeks. The movie industry tests every other day. So it really depends on what level of mitigation you want to reduce your risk. Temperature will help, but it doesn't eliminate. Remember, infection, just like any virus, if you're exposed to somebody with a virus, it'll take 2 to 3 days for the virus to cook before you show symptoms. This virus takes 5 to 7 days to cook. So by the time you have a fever, you're already 5 days into exposing someone else around you. So you really have to take more of the precautionary measures of mask, shield, social distancing, washing, and that will reduce your risk in that first 5 days.
Right. Well, that's a lot of information, and I think we've probably overwhelmed most of the folks watching. But Tatum, in wrapping up, talking about U.S. VMA, U.S. Virus Mitigation Agency, give us a couple of examples of some customers you've been working on, not their names, but the types of services you have been providing in real time.
Absolutely. I think I'll give a few recent examples. We were working with a county in Southern California, the superintendent district of schools, and disinfecting services for them, as well as testing. And I think to David Kahn's point with the electrostatic spraying, which I've learned so much about all the technology behind these products, we were able to disinfect multiple faculty offices, as well as classrooms and different kind of components within that school system using one of these electrostatic sprayers. And what was really key with this service is that it has a 1-minute kill rate, which basically there's a lot of different products out there. You'll see, like, even on a Lysol bottle, you spray it on the surface and it takes, sometimes products can take up to like 7 or more minutes. So you can spray it, wipe it down, and it's not actually disinfecting anything. The sprayer that we're using basically just takes 1 minute to actually kill the virus on the surface. So we could work around employees. They could come into the office and, know that within a minute of us coming into their space, they were totally disinfected. Another example is the restaurant that we just serviced in Huntington Beach. They had multiple locations. Someone got infected, someone tested positive within their workforce, and they were scared to death that they were gonna have to close down their restaurant for multiple weeks. We were able to come in there and the next day test over 200 employees across multiple locations, identify, I think there was 2 or 3 positive cases across both restaurants, and within the next day send the negative cases back to work. And I think beyond just the disinfecting and the testing, to kind of speak to the comprehensive services and technologies that we're providing, we're chatting with different local businesses and state fairs and even event production companies. Because like you said, Kurt, we want to go to events. We want to be around other people in larger gatherings. So really that's when the more comprehensive list of our services and our partners is going to come into play. It's not just the testing, it's not just the evaluation, it's the UV technology, it's testing, it's kind of how these things all come together in a comprehensive way. So we're currently working with a couple of different event production companies to bring those things back.
Yeah, it is interesting though. I mean, if we understand that COVID, as the doctor said, is a flu that has some really extreme elements to it, and we're going to see it and probably see it for a while. What businesses do, what government entities do, what schools do, to not shut down is one alternative, and many people choose that alternative. The other alternative to shutting down, though, is making sure you have a safe environment. And be it the safe physical environment or the safe environment for the people that work there, the people who go there as clients and customers. There is certainly a group of people that feel that if one person tests positive at a restaurant, the restaurant should be shut down for 14 days. I think that's a surefire way to eliminate the restaurant industry in California, if not around the country. Just like dress stores, if you shut down every retail store, if someone tests positive. The flip side is, how do you ensure you have the safest possible environment you can have? And then when you have someone who does test positive, you address it. And you address it not just with that individual, but with all the people who at your work location have come into contact with them. And I think that's what's really cool about this balance, and that's why we want to show everybody, one, this company that does put everything under an agency type focus, but two, what David Kahn does in terms of the physical location to address the hygiene of that physical location, and then a testing component that Dr. Pham presented, that is, how do we make sure if we have a concern, we address it and do the testing, or if we in fact do know someone in the workplace who has COVID, how do we ensure that the rest of the people that are working there are free of that? I will end on one example. My daughter's, one of her friends runs a business, and there was some concern that one of the family members of one of those people who worked at that shop came down with COVID. So what our advice to this friend is take all your staff to Dr. Pham's clinic. He has one in Westminster and one in Newport Beach, over and above what he does with USVMA, and have everybody tested. So everybody was tested, I think, I don't know, let's see what day it is. It was probably yesterday or the day before, and all of them.
Tuesday.
What's that? Oh, you know better than me, that's good.
Wednesday.
Okay, therefore you got the rapid test, they went to the rapid antibody test, and all of them came back clean. So taking that fear out of the workplace is really bigger than a lot of people, well, all of us business people have, right? We don't know how to deal with this situation, so we need to understand how to take that fear out of the workplace. And I think all three of you present a very good picture of how that can be done, and working with through people who are very competent and capable of doing that. So I want to thank you all very much.
I see a question too, really quick, about sourcing cleaning supplies and all of that from Nicole. We absolutely can help there. So I know that Kurt will funnel any questions on additional service questions that you guys might have. We're happy to answer.
Thank you. So everybody got an invitation to this. Everyone who did, Kurt Pringle and Associates is on the email. You can connect with Kurt at kurtpringle.com or Amanda, and we'll make sure you're connected to USVMA and all the appropriate folks. So thank you very much, Dr. Pham and David Kahn and Tatum. It was great being with you, and thanks for joining us.
Thank you for having us.
Thank you very much.
Thanks, everyone.